Hey y'all. Hopefully y'all can hear me. I am trying to get my presentation up. So just come on in and we are going to get started. I hope y'all had a good weekend. Let me see. Try. Let me see. Yeah, I know I always be forgetting how to do this. Let me see something. Hey friend, I'm trying to get my there it is. Okay. Hey friend, hey, tap in and let me know where you are calling in from only on Monday. You know it, okay, baby, because everything is trying to get back together, including me. I got up this morning and I went and worked out and I did my Pilates. And so I am still kind of in my workout gear. Y'all see this little bun on top of my head. But baby, it's Monday. Okay. Where are you tapping in from? Friend, I think you're in India. Are you in India? I know that I have some friends who are out of the country. I am in H Town, like Beyonce said. Okay, I am in Houston. So as y'all are coming in, make sure you tap in. We want to know where you're coming from, and where you are located. So I'm gonna put drop your location. Today we're going to be talking about therapeutic independence, or child, why I just made that up. Therapeutic independence. No, we're going to be talking about therapeutic equivalence. And so today I am excited about this because this is something that I feel like a lot of my friends are still trying to learn and understand. I think that therapeutic equivalence. I don't know why I want to say independence. I think that therapeutic equivalence can be kind of tricky, especially if you don't understand it. Let me get my light together. So we're gonna be talking about that today. Guess I'm from India, residing in El Paso. Oh, you in El Paso? Okay. Whoo, child, because I was like, how is that time zone correlating with this time zone? And friend, I know you tired. That's what I was thinking of myself. So, okay, cool. That's what's up. Come on in, tap in with your location, drop your location. We are just getting started. It's 6 minutes after 11. So I love to know where you calling from. What's your set, baby? I am in H-Town. I done told y'all. Y'all see Beyonce. She real serious too. Um, Today we're going to be talking about therapeutic equivalence. But before we tap into our lesson, I want to celebrate my friend Renee. When I tell you the winning circle is growing, you all are, look, let me just be, this is a moment of transparency, vulnerability, and honesty. There are times when I be feeling like my channel and the information I'm giving y'all is not productive, it isn't working, um it's not helpful. You know what I'm saying? It's times when I second guess myself. And so when you all pass your board exam, please come back and share that with me because it's encouraging for me. My friend Renee said, "Hey guys, I'm here to say I passed the PTCB exam. I'm so happy. I'm now a licensed registered nurse. I pray everyone who has taken the initiative towards nursing school passes." apparently Renee's um, you know, career path led her to nursing. Hey, love from High Point, North Carolina. Come on, NC, North Carolina, tapping in. Um, so it it's encouraging to see how people take their farm tech career and they go further with it. For me, my pharmacy tech career has landed me here with you, and I'm excited about that. But more than anything, y'all, can we just say congratulations to Renee? Congratulations, friend. I wish you the best in your career as you pursue the licensed registered nursing career and maintaining your pharmacy technician certification. Y'all, that is the best thing too. When you become certified in a trade, this trade goes with you. And right now, if I be honest, my son is 16 and he is, a junior in high school. And we're trying to think about what his next destination is going to look like and what this life is going to bring for him, right? And so in high school, he's taken a career educational course through the CTE program. He's already doing that in high school right now. And so we are trying to see, do we want to slide more into that or do we want to put him on a degree path? And I thought about it. I'm like, you know what? If you have a certificate, although the degree goes with you, but with certificates, they go a long way. Y'all, if somebody would have told me with my PTCB certificate, I would be a school owner, I would be an entrepreneur, I would be a friend to you, I would have never believed that. I love the way you teach. Thank you. Thank you so much. I'm blowing you kisses. I would have never believed it, y'all. So I know I'm going a long way around, but the point is embrace your study, continue to keep going, you know what I mean, and trying to become certified because you really don't know what's on the other side of it. Okay. So congratulations, Renee. Y'all tell Renee congratulations, okay? Because one day your name gonna be up here. Come back and tell me when you win, friend. We want to celebrate small wins. Even if you didn't pass the board exam, but let's say you understand calculations better because of one of my videos. Please say that. Let us know because I want to celebrate you as you're going along. Small wins turn into big wins. Big wins turn into big things. Big things roll over into generational things, right? Generational blessings, generational wealth. Start passing things down to your children, your grandchildren, your great niece, your great niece, right? You may not even be here to see them, but one day they may hear about you and you may be dead and gone, but still helping them in the life that they're in. So it's always about paying it forward, okay, y'all? Let's jump into it. So I told you we're going to be talking about therapeutic equivalence, right? And so the thing that I like to do is I like to break it all the way down. And the reason being is because when you're looking at um when you are looking at pharmacy uses languages or uses vocabulary. The pharmacy vocabulary pretty much a lot of times can align with what you already know, right? So I like to show you how therapeutic is just a bigger word for therapy, right? The root word of therapeutic is therapy, and that's why I highlighted therapy. I wanted to highlight the different types of therapy. So today, I went and I told y'all I did my Pilates, and I had told myself, I said, you know what, instead of working out 5 days a week, I'm gonna work out 3 days a week. And I'm gonna try to do it 3 days a week because I want to spend more time, preparing for my classes and focusing more so on my work, right? And then I thought about it. I was like, you know what? But I'm so much better when I do my exercises, right? I'm so much better. My blood is flowing, my body is energetic, I'm alert, you know what I'm saying? And I just overall feel better because I feel like I've accomplished something before I even started my work day. And so this morning, my 10-year-old, he saw me with my workout clothes on, and he was like, I thought you were only working out Wednesday, Thursday, and Friday. Baby, when I tell y'all my 10-year-old holds me accountable, if I switch up, he gonna be like, Mama, that's not what you said. That's not what you told me you was gonna do. And so I was like, I am, I did say that, but I think I want to go today. And so anyway, I went. And that is a form of therapy, you know, especially right now. I think that all of us are striving for something. I will be honest and tell you all, I am in a transition right now in my life, and it is one of the hardest things that I've ever had to go through. And it's also one of the things that's teaching me the most about myself. It's teaching me the most about where I am, what decisions I need to make. It's pushing me to do things I've never done before. That's what's making it hard because it's a little scary, it's new. I don't recognize this. I don't know how I'm supposed to feel in this. One day I feel this way, next day I feel another way. And it's all of those things that really make you feel like, what in the world is going on? And it's the thing that I need that's going to get me to the next level. And so, with that being said, some days I wake up and I feel one way, the next day I feel another way. And I'm realizing my exercise is helping me keep the stress off my chest. Okay. Exercise so you can keep that stress off your chest. I tell people all the time, I tell myself, look, we got to get that stress off your chest because that leads to heart attacks and cardiovascular problems and all of these things. And so therapy doesn't just have to be medication. Some people say I'm struggling with anxiety. I have test anxiety, right? When you talk about test anxiety, and immediately people shy away from doing the test because they're like, no, 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 my heart started racing fast. I get nervous, I start sweating, I can't think, my mind is swirling, I'm spinning and I'm spiraling. And all of that may be true. That may be something that does happen. But if you lean into different type of therapy, maybe you won't experience that as bad. Maybe it'll be completely gone. Maybe it won't be at a 10. Maybe it'll be at a 5 where it's a little bit more manageable, a little bit more controllable. And so when I think about types of therapy, you can have medication therapy, which is obviously what we do in pharmacy. We dispense medication, right? Behavior therapy, that's when they're working with a therapist. Physical therapy, that includes exercise. So that's what I did this morning. I did some sort of physical therapy. Massage therapy, when they're rubbing on you and relieving that muscle tension. I mean, a good rub down too, right? Holistic therapy, emotional, social, spiritual well being. There's so many different forms of therapy, but therapy is intended to relieve or heal a disorder. So when you think about therapeutic, I want you to think about therapy, okay? The different types of therapy. And y'all see my girl over here with her hands out. Baby, she's in meditation. She's trying to get it right. She's trying to get it right because Monday is here, okay? And so as you are studying and you are retaining new information, you're doing something new, you want to also make sure you're putting yourself in the best place that you can to receive new information, right? You want to receive that new information. And sometimes, it's difficult to get a workout in. Sometimes it's just walking. Sometimes it could be reading a book. Whatever it is, that can be a form of therapy. So when you think about medication, I want you to think about it in a form of therapy. Medication therapy, okay? Now we're thinking about equivalence. So we talked about therapeutic. Now we're going to talk about equivalence. Well, the key word or the root word to equivalence is equal. Break it down, friend. Break it down and make it. When I used to be in church and I was a young girl, I would hear them tell the preacher, make it plain. So that's what we're gonna do, friend. We're gonna make it plain. Equal. Equal is the root word to equivalence. It says equivalence is the condition of being equal or equivalent in value, worth, function, etc. So that means that if something is equal, it's going to be the same on this side as it is on this side. I think that's part of the problem in certain relationships where it could be a job relationship, it can be a partnership, it can be a friendship, where we're wanting, if I'm giving you the best that I got, like Anita Baker said, giving you the best that I got, baby. If I'm doing that, then you need to be giving me your best. And that's the thing, equal size. One side over here is doing this thing, one side over here doing this. And people, especially in relationships, child, people say, well, I told you my deepest, darkest secret. And you ain't told me nothing. So in your mind, you think, well, your friend got one up on you because you done spilled your beans and told them everything. And the whole time, all they did was listen. They taking your information, and you start thinking, well, you can use this as ammo when we get into a fight or whatever. And so somebody may say that doesn't feel equal. And then another example is when we're both on the same page, walking the same pathway, and I'm doing my thing, you're doing your thing, but in the middle, we're communicating, and that's what keeps us balanced. And those are the type of relationships that work, is because here we are doing the same thing. I'm having my individual experience, you're having an individual experience, but then in the middle, we're talking about it and we're meeting and we're walking through it together. That is what equivalence looks like, equal, right? It can be, in this sense, when you think about pharmacy, you may say, well, I don't take Benadryl because Benadryl makes me sleepy, so I'll take Zyrtec instead. Oh, okay. So that means that Benadryl and Zyrtec both do the same thing. They work for the same reason, but they may have two different side effects to somebody. Somebody else can take a Benadryl and not get sleepy. Somebody can take one and get completely sleepy, but they're both used to treat allergies, right? So when you think about being equal, I love to use everyday examples and everyday things that are happening, because I want to make sure that you all are not keeping the information you're learning from pharmacy here and then the information you're learning from your life here. No, we need to bridge the gap and bring them together, right? We want to equalize it. We want to be equal. We want to be on the same path, because the thing is, you're one person representing in one pharmacy. So you're going to use your information from your past, you're going to use the information you're learning now, and you want to use them together to present a whole person in the pharmacy, right? So don't ever discount what you've learned in the past. Use it to help you now. Okay, friends? As you come in, make sure you tap in with your location. Drop me something in the comments so I can know you in here. Okay. I want to know. I want to hear from you. So let's go back. Look, child, wait a minute. Hold on. Hold on. Hold on. Wait 1 second. Baby, you see what I'm saying? Tell them my business. Okay. Okay, here we are. Friend, I said, what in the world? Okay, so here we are. Therapeutic equivalence. It says, which answer below is an example of the same dosage form? When you think about dosage form, this is what I want you to think about. Before we even go to pharmacy, I want you to think about this. The dosage form, or the form, let's talk about shoes for a second. And I've used this example before, and hopefully this sticks with you. And let me, so y'all can see that all the way. So when you think about a form, I think about shoes. So let's talk about this. You have tennis shoes, you have boots, you have sandals, um, you can have casual, little shoes, flip-flops, house shoes, stilettos, pumps in the club. Okay. You can have all of those shoes, right? But all of the shoes are meant to do what? What do you do with your shoes? You put them on your foot. You never see a person with a shoe on their head, on their shoulder as a purse. You never see them, carrying it on their chest as a shirt. No, Shoes are meant to do just what shoes do, and they go on your foot. Now, you have different manufacturers of shoes. You have, Adidas, you have Marc Jacobs, you have, let's see, you can have, um, Nike, Steve Madden, Walmart brand, all of these different manufacturers and brands. And even though the manufacturer is different, they're all made to fit on your foot. The shoe could be red, yellow, green, purple. It can have one straps, two straps, and no straps, like Dr. Seuss. It can have strings that you tie up. It can be a slip in and a slip out, but they all are meant to go on your foot. That is the same thing when you're thinking about a dosage form. When you think about dosage form, I want you to think about how they're all meant to do pretty much the same thing, and they're all in the same form. So you have liquids, dosage form, you can have a solid dosage form, you can have a semi-solid dosage form. And if a drug is a semi-solid, it's all going to be in the same, same area, right? Um, and just because a drug is a semi-solid doesn't always mean that it needs to go in the same place. So when I think about paste, right? Paste is assuming a semi-solid, and you have toothpaste. So toothpaste we use in our mouth, but you may also have another paste that you can use as a topical on your hand. Does that change the dosage form? No, they're still semi-solids, but they can be used in different areas of the body. When you think about dosage form, you want to remember that they are going to be the same form, but they may be used differently, right? Um, when I use my stilettos, child, let me tell the truth. I ain't even wearing stilettos no more. I wear the heels. They be kind of like chunky heels. And they be kind of wide because look, baby, I need some support. But I'm not gonna wear my heels to my Pilates class, right? There's a time and a place for everything. So even though they're both used and they're both the same form because they go on my feet, I'm using them for different occasions. Same way with the drugs. When you think about dosage form, I'm showing you right here an implant. Okay, you see this implant. Now, this implant is a solid dosage form, and so are these lozenges. Okay, now the implant is going in the arm, and the lozenges go orally, but they're still the same dosage form, and they are still going in a solid way into the body. Does that make sense? So when you think about therapeutic equivalence, you want to remember that it has to be the same dosage form. Write this down because you will be asked about this. Therapeutic equivalence must be the same dosage form in order for it to be considered therapeutic equivalent. Okay. Remember on the previous slide, we talked about Benadryl, Zyrtec, and those other medications. Well, the same therapeutic equivalence, what makes them the same is they're the same dosage form. Okay. So you want them to be the same dosage form when we're thinking about something being therapeutic equivalent. Okay. As you come in, baby, tap in with your location, drop your location, and let us know your name. We want to know from you. We want to hear from you so we'll know who's all in the room. Okay. So here it says, which answer below is an example of the same dosage form? Can y'all drop your answers in the chat? Let me know what you think the answer is. Even if you're watching the recorded version of this, please put your answers in the comments because I want to make sure that you are also getting the same information even though you're watching the replay. Okay, which answer below is an example of the same dosage form? Is it syrup, suspension, and suppository? Same manufacturer and same price? Capsule, cream, and OTC drugs? or tablet, implant, and lozenges? Tell me which one you think it is. While y'all put y'all answers in the chat, I'm gonna tell y'all a quick little story about my experience with implants. So after I had my 10-year-old, I got an implant in my arm for birth control. And the birth control is good for 3 years, right? So they put this little implant in my arm just the same way you see it with the lady. And I try to look for the mark, but I don't see it anymore. But anyway, they put it in my arm. I'm waiting on y'all to drop y'all answer in the chat. And so they put it in the arm. I ain't feel no problems. Okay. This is just my experience. I'm just telling y'all. I ain't have no problems. Everything was fine. And then for the first year, I think it was fine. I don't remember having any serious side effects. Well, by the time I got to year 2, I want to say um that I started having migraines. Now, before I was having the migraines, y'all, I couldn't even lose weight. I was probably like 217 after I had, because my 10-year-old was about 9 pounds. So yeah, he was over 9 pounds, y'all. He was a big baby. So anyway, I was trying to lose weight, couldn't lose weight, whatever. So I was telling my mom was like, it's probably, the implant. And I'm like, she was like, it's probably that birth control. That's what my mom was telling me. I was like, it ain't the birth control. So then I started having migraines. And I had never had a migraine before, and it scared the Jesus in me. Okay. And I'm like, what is going on? And so, anyway, it was a side effect from the implant. The implant was for birth control, and it was the Nexplanon. I don't know if y'all heard of Nexplanon. And so, anyhow, I wound up getting it removed and all of those things. And so now I don't have the migraines anymore. But, that was a side effect. And the interesting thing is that I had that implant for a while, but I had never had those experiences. And then I started, having those experiences even after I think I had the implant for like a year. And then I started having side effects maybe year 2. You know what I'm saying? And then by year 3, I was really having them, and I was like, I got to get this out. And so I ended up taking it out, and pretty much all of the side effects went away. I was able to lose weight. I lost weight immediately, by the way. And then I stopped having the migraines and things like that. And I didn't realize that it was the implant. My mom kept saying that it was, but I think because I had been taking the medication, or I had it in my arm and it hadn't given me any problems in the beginning, that in my mind, I thought, well, it never bothered me before. Why would it start now? But child, look, mamas be knowing. So anytime I see an implant, I always think about my experience with them. Let's see, do we have any answers in the chat? What y'all answers at? What do y'all think it is? Which answer below is an example of the same dosage form? Did anybody? I don't see y'all answers. Okay, well, child, let me give you the answer since y'all don't want to put it in the chat. Let me see. The answer is D. Tablet, implant, and lozenges. They are both, all three of them are solid dosage forms. Solid dosage forms. All three of them are solid dosage forms. Okay, now let's look at this one. I told y'all I like to talk about food. Okay, as you come in, drop your location. Let us know where you're from. Welcome in, friends. Baby, this little bun is sliding down. I told y'all I went and worked out this morning. So this little bun is sliding down. Okay, so it says which food has the same active ingredients? Now, think about this. In order for a drug to be therapeutic equivalent, it must have the same active ingredient. Write that down. In order for a drug to be therapeutic equivalent, they must have the same active ingredients. Okay. Now, I know y'all like to eat food. I know y'all do. Y'all can't tell me that y'all don't. I know that y'all like to eat food. So Tell me which one of these drugs, or excuse me, which one of these foods have the same active ingredients? Which one you think has the same active ingredients? Which one y'all think have the same active ingredients? Tell me what you think. Now, somebody might say, look at nachos and hamburgers and say, what does this have to do with pharmacy? Well, again, I want you to think about how your previous life, previous experience, all of the things you've learned up until this moment is meeting everything you're learning now, and we're bridging the gap, bringing them together, and we're presenting it as a whole person in the pharmacy. Why? Because it's important that you use the information that you've known before and apply it to pharmacy. And then it's important that you use the information you're learning now to apply it to pharmacy. Okay. Which food has the same active ingredients? That's going to be drum roll. Boom, 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 boom. Letter C, grilled chicken and roasted chicken. Why? Because the active ingredient is chicken. Nachos and hamburgers may both have cheese. They may both have ground beef, but one used tacos, or excuse me, look at me greedy. One used chips and one used buns. Okay, pound cake and pizza, right? Same thing. Okay, when you're thinking about active ingredients is what you can taste. Okay. Now, there may be some drugs that have inactive ingredients, which are filler ingredients, right? Inactive ingredients are going to be what makes it whole. I will tell you that when you eat a cake, or let's say you eat a hamburger, and in the bun they have milk in the bread in the bun. You're not going to say, "Ooh, this bun, I can taste the milk in this bun." Typically, you don't hear anybody say that. Maybe they can, but you don't hear anybody say, "Oh yeah, I taste the milk in this bun." You don't hear that, right? So when you're thinking about active ingredients, it's going to be the ingredient that is actually moving around, active. It can be taste, it can be, you know what I'm saying, seen, felt, whatever it is. When you taste, last night I had a cinnamon roll. I had a Cinnabon from this place called Cinnaholic. It's a vegan cinnamon roll place. And they have them here. I'm sure when I went to LA, they had one in LA. So I'm pretty sure they have them everywhere. So I was eating it, and then I let my husband get some, and he was like, "Oh, this is too rich for me." And so he didn't really eat it. But the point is that he can taste the active ingredient, which was sugar, because I had some sugar in there, strawberries, right? And then the frosting was old school frosting. I think it was vanilla. You can go in there and build it from the bottom. You can pick whatever frosting you want, and then whatever toppings. I have put like pie crumbles on mine. Baby, it's a whole thing, and it's vegan. It is the bomb. Okay. But he was like, "This is rich." And when you're tasting food, whatever ingredient you taste, that lets you know that that is the active marching ingredient moving in that particular meal, recipe, food, whatever it may be. Okay. So when you think about active ingredients, I want you to know that if the drug has the same active ingredient, it is therapeutic equivalent. Write that down. Same active ingredient equals therapeutic equivalence. Okay. I want to check in with y'all right now because this, first of all, Wendy, I love Wendy, and I'm praying for her right now. And I don't know if y'all are keeping up with everything that's going on, but baby, how you doing? Okay, how are you doing? How is your studying going? I want to check in with you all because I think that one of the things that I am experiencing in my transition, and if you're just joining in, we're talking about the transition that you go through when you are becoming certified, or just a transition in life when you're leveling up. And I just shared not too long ago about how I'm in a space of transition, and I am um, going through something that is going to level me to the next level, but it is pulling me and is making me do new things, is making me go into territories I've never gone into before, or at least not in this capacity, and is stretching me to believe in myself at an all-time high. Um, and it's so easy when we are in transition to focus on the destination and to focus on, well, when I get certified, I'm going to be happy. When I get certified, I'm going to celebrate. When I pass my board exam, I'm going to, take myself out for a nice dinner, or I'm going to treat myself. And what I'm learning about the space that I'm in right now is it's not about the destination, but it's about the journey. It's about every emotion that we go through in order to gain the success. It's about every person we meet along the way that helps us be a better person, understand our studies better, and understand ourselves better, right? It's also about what you learn about yourself. There are things that other people can teach you about yourself, and then there are things that hard times in life will teach you about yourself. And then it's sometimes when yourself will check you and say, hey, your conscience will speak to you, right? And so I'm checking in because I feel like we're all thriving and striving to get to the destination. And sometimes we are so focused on that task that we miss everything in the middle. Friend, don't lose your happiness, your joy, your peace, the thing that makes you you, trying to get the thing that is at the end. It's nothing wrong with striving for the pot of gold, but in order to get to the pot of gold, you want to embrace the journey. A lot of times, I don't think that it's about the end. I think it's about what you're experiencing during the time. So I'm reminding myself while I remind you, enjoy the journey, embrace it, embrace you, embrace the opportunity that you've been given, because you're giving something that a lot of people won't be able to get. And even though we're all stretching and trying to obtain, some of you all are trying to become certified. I'm trying to get to the next level. It doesn't mean that, just because the thing I want you to know is, just because I'm certified and I'm teaching you all, don't mean that I'm not striving to get something new as well. You know what I'm saying? Like, just because I'm already certified, it don't mean I'm not trying to be better at something. I'm also striving and trying to be better and trying to gain new territory and new spaces and learning new things. And so we're all pushing towards something new. And so as we do that, we have to encourage each other. And if you don't take anything away from this, I would just say, if you only take one thing away from this, I would say enjoy the journey. Don't miss the journey worried about the destination, because you have a family, your friends, yourself to love on. All of these things are working for you right now. And yeah, the destination is up ahead, but right here, you can love on yourself. You can celebrate your small wins now, and you can celebrate what you have now, and not be so focused on what's ahead or what's in front of you. So, I like to throw that in, because my thing is, as we're pushing forward in life, there are going to be times we're going to be tested. And as we're being tested, we can't lose ourselves during that moment. Okay. So as we continue to push through with therapeutic equivalence, there is something called same clinical effect. Same clinical effects. Okay. Now, the same clinical effects is where the drug pretty much is safe, effective, and it's a high quality. Okay. So when you're thinking, it says Do generic drugs have the same clinical effect as the brand drug? And the answer is yes. Generic medication works, or generic medicines work the same way as brand name medicines. When you think about the generic medicines, I've had people come into the pharmacy and you give them their pills and they open them up and they say, this ain't the red pill. This a blue pill. I take a red pill. And what they don't realize is it's the same generic drug, but a different what? Manufacturer. Remember, I told you earlier, I said it can still be therapeutic equivalent if it has the same color or a different color. If it does not, look the same, right? But it needs to be the same dosage form. So if you're saying that the red pill has 3 circles on it and the blue pill has no circles on it, the colors are different. It may look different, but it's still the same dosage form, right? And it's still the same. What else did we talk about? Dosage form, same active ingredients, right? That's what we talked. So look, I'm quizzing y'all as we go along. And so they may not understand, because patients don't always understand. Well, it's the same drug, but the manufacturer is different. And that's what you want to remind them. No, ma'am, it's the same drug. The manufacturer is different. Now, I've had some patients say, well, I don't like that manufacturer. I want to use this manufacturer, even though it's the same generic name or the same brand name, but the manufacturer is different. And when you think about it, some people may like Adidas more than Nike. They may say, hey, Adidas shoes are more comfortable than Nikes. And yeah, Nike and Adidas both sell sports shoes or tennis shoes, but I want to wear Adidas because I like the comfort that they provide. That's the same thing that the patient can say about the manufacturer. At that point, we're talking about personal preference. Yeah, personal preference at that moment, because even though the medication is works the same, the patient may feel a different level of comfort or may have a different level of trust in that medication, and they want to stick with that same manufacturer. And this is when you get into, if the doctor ordered the brand but the patient requested the generic, can we give it? Yes, we can, as long as the doctor said brand is ordered, but generic is okay, right? The doctor has to let us know. Now, if the doctor say brand name medically necessary, then that's different. We can't do it. But if the doctor wrote the brand, but also said generic is okay if available, we can give the patient whatever they ask for, okay? So just because generic medications work the same and they as the brand name, the patient can still request that they get whichever drug they want by the manufacturer, as long as it falls within the same level of therapeutic equivalence. Come on, baby. Go, baby. Okay. I'm going to help you gain the knowledge you need to know. That is the bottom line. Okay. I hope y'all are writing this down. If you're not, you can always pause, run it back, write it down, pause, run it back, write it down. Okay. This one says, what is the safety profile of a drug? Safety profile. The root word in safety is safe. Baby, we need you to be safe. I should have put a little stop sign right here, because when I think about safety and then I think about the word safe, for whatever reason, the crossing guard is coming to my mind. Y'all know the crossing guard be walking around with that little red stop sign, be telling people, hey, stop. Come on, baby, come on. Letting them kids come across the street. Then people be acting like they don't see the crossing guard. You see the crossing guard and you see them kids. And if y'all didn't know, if you in the school zone going past the allowed limit, speed limit, and you get pulled over, it's a felony. Oh, yes, ma'am. Yes, ma'am. It is a felony. They're not playing with y'all. Don't be speeding in that school zone. Okay. Um, what is the safety profile of a drug? It says the safety profile is the movement of the drug in the body. So when we think about that, we're talking about pharmacokinetics. Write that down. Pharmacokinetics. Pharmacokinetics is ADME, absorption, distribution, metabolism, and excretion of the drug. Absorption is when the drug is taken by the mouth. If you look at my little image over here, it's taken by the mouth here, okay? Comes on down. And now, how is it being metabolized in the body? Breaking down in the body, breaking down in the body. As you come into the room, drop your location. In the classroom, drop your location. And then the next one says, okay, after it's broken down, how is it distributed? How is it distributed throughout the body, right? Where will it go? So if a medication is for the knee pain, is it going to go directly to the knee? The medicine is going to go whatever spot it is used for, right? And then the excretion of the drug. So you got absorption, distribution, metabolism, and then excretion. Excretion is going to be how does it leave the body? So, you can use it, urine, let it go through the urine by, the urine system, and it comes out that way. It can be excreted through poop when they go and you have a bowel movement. It can be excreted through saliva, through sweat, right? Through vomit. Somebody vomits, medicine goes back out. Excretion is how the body gets rid of the drug. Okay. Safety profile. If the drug has the same safety profile, it is considered what? Therapeutic equivalent. Baby, this whole thing is about therapeutic equivalence. Why? Because therapeutic equivalence is on your board exam. And you need to know these things. Remember, I told y'all too, when you're studying, it's not really about quantity, but it is about quality. I want to focus on topics that I know you're going to be questioned over so you can retain the information when you go to take your exam and you see this and you like, oh, I know what this is. I know exactly how to handle therapeutic equivalence, right? Now this thing says therapeutic equivalence. What is therapeutic equivalence? What do y'all say? I want to give y'all an opportunity to drop your answers in the chat. Baby, y'all in this class and y'all not saying why y'all not dropping y'all answers in the chat? Drop your answers in the chat. While I'm waiting on y'all to respond, I have also thought about offering this class on Saturday mornings instead of Monday mornings. What do y'all think about that? Would y'all prefer Saturday mornings instead of Mondays? Because I have thought about that. I said, well, I could possibly offer this class on a Sunday. Or I don't know why I keep saying Sunday. Maybe Saturday or Sunday. I'm thinking more so Saturday though. I could possibly offer this class on Saturdays at 10 because I do know a lot of my friends are at work right now. And I know, obviously you guys are going back and watching the replays and we can see that. But I know some of you all would like to be in the live class. So if you're open, if you want me to do it on Saturdays at 10, let me know. I'm gonna also do a poll in my Facebook study group. If you all have not joined that Facebook study group, make sure that you join in. I will post that. I can post a link in the description of this video. And then I'm gonna post a poll in there to see, and then I'll ask on YouTube too what you all want. So just let me know what your thoughts are. But make sure that you show up because the whole reason for doing it is to get your engagement. Okay. I want to make sure you all are retaining the information. If you have been watching this channel and you're not subscribed to the channel, please make sure you subscribe, ring the bell for notifications, like and share this video so we can get into the algorithm and we can help other people all around the world become certified technicians. Okay. The answer is letter D. What is therapeutic equivalence? It is D. It is all of the above. All of the above. Okay. All of the above. Therapeutic equivalence. Which drugs are therapeutic equivalent? Which drugs do y'all think are therapeutic equivalent? Is it the Tylenol and the Advil, the Pepto and the Allegra, or the Robitussin and the Delcium? Can it be one or two? Which ones do y'all think? One or two drug? Do we have multiple things here that can be therapeutic equivalents? Even if you're watching this as the replay, drop your answers in the comments because I want to engage with you and I want you to engage with me, okay, friend? Baby, talk back to me, okay? That's basically what I'm saying. Talk to me, man. Okay. Talk back, talk back. Let's see. Let's see. What are y'all dropping in the chat? Let's see. Therapeutic equivalence. What is an example of that? And here it actually can be two. It can be Advil PM and Tylenol PM and Robitussin and Delcium. The only one that does not match is going to be this Pepto and this Allegra because they do not do the same thing. Baby, because Pepto is for the stomach, Allegra is for allergies. Okay. The last thing I want to leave you all with as we wrap up our session for today is test strategies. When you go and you take your board exam, because I do know that I have some friends who are going to be taking their test soon. Also, if you're taking your test this week, drop your date in the comments. If you're taking your test this month, drop your testing date in the comments and where you're taking it from, like what city you're in. I want to send love and light your way. Love, light, and success. Okay. When you think about test strategies, this is what I always tell people: answer all the questions you know first, then go back and answer the ones you are unsure of. Because a lot of times when you answer the questions you know first and you build that momentum and you boost your confidence, when you go back and read the ones you didn't know, you realize how much easier this question was. And it's like, wait a minute, I thought that was going to be hard, but that wasn't hard at all. You see what I'm saying? So when you go through and you read the questions first, and do the ones that you know first, and then go back and do the ones you don't know, that gives you an opportunity where you see what I'm saying, where you can boost yourself, your self-confidence, boost your self-esteem, and then you go back and you redo it. Okay. And I don't want to say redo, but you go back and you answer the ones that you didn't know. And then it makes sense because sometimes what happens is what you thought you didn't know will jump out on the page and you're like, oh, I do know that. Okay. That's that. So always do the ones you know first. Flag the ones you don't know because this is a computerized test. So you're going to do the ones you know first, flag the ones you don't know, and then go back and redo it. And so, hey friend, hey, how you doing today, girl? So what you're gonna do is you're gonna go through. So let's say you know 1, 2, 3, 4, and 5, but you get to number 6 and you don't know number 6. Flag it, go to the next one. Let's say you start the test and you don't know 1, 2, 3, 4, and 5. So what? Flag them all. Go to I don't care if you didn't know all of the questions until you got to question number 20. So what? Ain't nobody taking that test with you. It's just you taking it by yourself. You get to question number 20, and then what you do? You pick the answer and you keep going, right? Make sure you flag the ones you did not know. So that way when you get to 20, you can, remember to go back and redo those. After you do all the ones you know, go back and do the ones you didn't know. Let's say when you go back to do the ones you didn't know, you still run into ones you don't know. That's fine. Leave them flagged. Keep repeating that cycle until you complete your board exam. The other thing that I didn't put here, this one of my secrets. Okay, this is a secret. When you take your board exam, explore your test. Go all the way from the number one question, and you can click all the way through before you answer any questions. Why? Because some of my friends have test anxiety because you don't know what question is going to be next. So if you can explore the test before you start answering the questions, that will help you to know this is what's all on the exam. Some people are answering the exam from the end to the beginning. So I see some people who say I did it from 100 and I worked all the way up to number one, because some people say the back of the test is easier than the front of the test. Hey, however you need to work that thing, you better work that thing, okay? Work it and make it work for you. Okay, friend? Look, don't let that thing stress you out. I keep telling y'all it ain't nothing but a piece of paper. And then the other thing I will tell you is when you're solving your test questions, make sure that you highlight or underline or jot down any important information present in each question. Okay, present in each question. So today when I was telling you about therapeutic and then we broke the word down to therapy, that's the same thing I want you to do when you're taking your board exam. You're welcome, friend. You are so welcome. Thank you for joining. I appreciate you. I hope you enjoyed the lesson. Thank you so much. When you are taking your board exam, break the words down. Make it make sense to you. Okay, because the whole reason for this is for you to be successful. Okay, be successful. You are welcome, friend. Thank you for joining. So welcome. Whatever you need to do, friend, to win, win. Baby, because today we gonna win, win, win no matter what. Okay. That is what this whole thing is about, is winning. So don't ever, get caught up in doing something one way. Okay. Follow me on TikTok, y'all. I am still sharing my TikTok with you all. I have a little over 3,200 subscribers. Thank y'all so much for or followers. Thank y'all so much for following me on TikTok. There I am posting jobs. Baby, I seen one job yesterday paying close to $30 an hour. I'm posting pharmacy tech travel jobs. So if you want to travel the country and get paid to do it, pharmacy tech travel jobs is something that's going to be helpful to you. Okay, friend? Baby, let me tell you, if this is your first time and you ain't never seen this channel before, subscribe and follow, because I am giving you the information you need to be a successful technician in 2024. Also, I have that Facebook study group. I'm going to post the link in the video description. Join that study group, baby. It's a little over 1,200 people in there, and we talking and we playing and we laughing and we studying, okay? We building relationships, because you know what I told you before. Sometimes it's not what you know, but sometimes it's who you know. And you never know who's in that study group, who joining that group, who's going to be a part of it, who may be in the group right now, not certified, but may get a position tomorrow as a certified technician that can get you hired, and then get your mom and them hired, your cousin and your brother and them. Baby, let me tell you, don't play with relationships, okay? Take them real, real serious, and network, 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 network. This whole thing is about us working together so we can come together for the greater good, and not just the patient, but also for each other. Okay. When do you usually go live on TikToks? Girl, it is so random. It's so random. I tried to do it. I tried to do it. This is gonna sound weird, but I try to go live on TikTok at midnight every Friday at midnight. I am trying to do it every Friday at midnight, and it be about 200 people in the room, and we just be chatting. I be telling them, a lot of my story, how I became a certified technician. I talk about, how I got the school started, and then I also give information about how people can get hired, and things like that. So, girl, it just be random. Okay, I will try and remember that. Yes, for real, friend. Try to jump on. I think that if you follow me, it'll give you the notification And then that way too, you'll know and you won't miss a live. But thank y'all so much for joining. I am so happy. I want to be a respecter of your time, so I don't want to keep you in past 12 Central Standard Time. Again, I'm thinking about doing these classes on Saturdays at 10 o'clock a.m. From 10 to 11 Central Standard Time. If that is something that would work with your schedule, please let me know. I'm gonna put a poll up because I want to make sure that I am including everybody in that. But again, I love y'all. Have a great week, great studying, and I will see you next Monday, same place, same time. Bye. See y'all later.